Hello, everybody. Thank you so much for joining us today. This is the Shifting the Investment Paradigm, the Power of Innovation side event at the Global Disability Summit 2022. Oh, apologies, I'm getting a bit of interference there. Let's turn that off. So welcome so much to the session today. We're really delighted that you're joining us from all over the world, and we have a fantastic panel and discussion lined up. This session is hosted by the Global Disability Innovation Hub, and we are a research and practice centre driving disability innovation for a fairer world. We work in 41 countries around the world and have reached 22 million people since 2018. And this session is really to look at insights and learnings from kind of different evidence and global programs around the space of innovation and AT. And we're very much also looking at 4 years on from the Global Disability Summit in London. And as part of that, looking at a few reflections as well from our kind of UK aid funded 80-20-30 programme that was launched during that event to really look at what works in this space and this sector. And we're also joined today by a fantastic panel that you'll be hearing from a bit later on, who are going to bring insights from right around the world into different approaches and mechanisms to really driving this area of work. Just a few things on accessibility. Captioning is available for this webinar, so you should be able to turn that on by using the closed caption button at the bottom of the screen. The chat functionality will be turned off between attendees just to limit screen reader interruption, but you can access us on that, and we do invite everybody to put Q&As in the Q&A box, and we'll be trying to come to them throughout the session and towards the end as well. So if you have any particular questions for our panelists or anything wider on the topic itself, please do let us know. This session will be recorded and shared, and international sign language is also available. So it's just a bit of an overview of what we have coming up today. So we'll hear a little bit of an introduction and a keynote, and then we'll hear a little bit more around a particular innovation journey from WASI, who will be coming to you a little bit later, and then leading on to the panel discussion and Q&As. So I'm now going to hand across to my colleague, Professor Kathy Holloway, who is the Academic Director and Founder of GDI Hub.
Thank you very much, Louise, and thank you everybody for joining. I see some people are still arriving, so as you trundle in, welcome. It's really exciting, isn't it, the Global Disability Summit, and as Louise set the scene for us, we have come a long way, I think, as a sector for assistive technology, and we're delighted to welcome Pascal to speak as a keynote.
Kathy, I think we've lost your sound there.
Yes, Kathy, we've just lost your audio there for a second, Kathy. Maybe we can just try again and see if that's come back on. Oh, no, we've still lost you.
You can hear me now, can you?
Oh, perfect. Yes, we've got you back. Thank you so much, Kathy.
Sorry, I don't know where I got to. Where did I get to, Louise? What did people hear?
We were just hearing the very introduction, so the excitement of joining the summit.
Okay, excitement, joining Summit. Recap. It's exciting. It's even more exciting when the tech works for these virtual events. But we are delighted to have Pascal here to speak to us from the Global Partnership for Assistive Technology. And I think the gravitas that At Scale brings to the sector is phenomenal. And it's also supported by the grassroots ecosystem of accelerators globally. So we run with AMREF Innovate now, and then we have the AssistTech Foundation in India with Pratik, and Remarkable with Pete in Australia. And together, I think we're beginning to see what we can do within the innovation space. And that will be brought to life when we hear from WASI, who have come through the AT2030 Assistive Technology Impact Fund. But there's still a massive problem. So why do we need this conversation? We need this conversation because the amount of money being poured into innovation within assistive technology is significantly insufficient. And it's insufficient to the size of the opportunity. So At Scale have published some great work showing the 9-to-1 return on investment when you look at the individual level, when you look at the cost benefit analysis to the individual and their immediate family. But further work that we're doing shows that there can be up to 160% growth within the economy when you actually look at the downstream and upstream factors of investing in the sector as a whole. Investment can revolutionize the sector. So the people that manage to seize the opportunity in the next year or two will see huge returns, both in terms of economic and social gains. We'll only do that if we work together. So if we work from the top down, like with the likes of At Scale, with ourselves at the WHO Collaborating Centre on Assistive Technology, we can help synthesize knowledge. We can help drive sectorial change within governments, within the policy sector that's needed, both within, say, healthcare sector, within the education sector, but also within ICT, within the digital infrastructure that's powering our communities. We can only do that, though, when the innovators are connected to that space. So we can't just go top down. We must continue to work at the accelerator level, and we must begin to build that meso level of learning that connects the accelerators, the innovators, the disabled people who are coming up with amazing ideas to the wider infrastructure. So what needs to change? We've been changing it through 80-20-30. I genuinely believe what you're going to hear is a showcase here where we've managed to invent the Impact Fund with our partners Brink and Catalyst Funds, where we've managed to deliver an accelerator in Africa with Bernard leading it with AMREF and with partners on the ground. Those things have shifted the needle slightly. They're developing evidence for change. What we all need to do now is continue to work together and build a significant by 10, by 100 investment space into this space. And with that, I'll hand over to Pascal, because I'm sure he will have some amazing insights from At Scale. Thank you.
Thank you, Kathy. Good morning, everyone. Good afternoon, good evening, colleagues and friends. My name is Pascal Bijleveld, and I'm the CEO of AT Scale, the Global Partnership for Assistive Technology. And it's a real pleasure to be here with all of you for this side event today. I do believe, like most of you here and all of you here, I would imagine, in a disability inclusive future. And I think that all of us here today know that access to suitable and affordable AT is critical to that, reaching every corner of an individual's life and livelihood. Yet we know that 90% of the 1 billion in the world who need it don't have access to it. And that is particularly affecting low and middle income countries. We also know about the transformative impact of AT on people's well-being, on their families, on communities, on entire nations. But how do we provide the people who need it with the AT they need? The answer, of course, is incredibly complex, and there's no silver bullet. AT Scale was established to address the many complex barriers holding us back, such as the lack of resources, political prioritization, cross-sectoral coordination, as well as specific market challenges in key product areas such as wheelchairs, prostheses, hearing aids, and eyeglasses. And of course, on innovation. And we need to invest more, and we need to innovate more. And we need to invest more in innovation. And all of this is all mutually reinforcing. First, as a community, we need to build a compelling case. And as Kathy mentioned, because, of course, we all know there can be no meaningful inclusion without AT, but this fundamental fact and human right is unfortunately not always enough to spur more investment. And so as one of our contributions, we published the case for investing in AT, which allows us to now clearly state that for every dollar invested in a provision of assistive products, a $9 return can be expected through improved educational outcomes among younger users, better paid employment and higher productivity among adults, lower longer-term healthcare costs due to health complications, and the reduction of challenges caused by aging. And this powerful investment can be further bolstered by innovation, especially those innovations that lead to lower production costs, lower delivery costs, and or allow for more streamlined access. Again, all these things are mutually reinforcing. At AT Scale, we're also working a lot on market shaping, working to build and shape markets for these priority products and their related services. We've seen in parallel global health markets the impact that those kinds of market shaping approaches can have on vaccines, for example, or HIV drugs or malaria bed nets, with significant price reductions and allowing rapid scale up. And creating healthy markets is also critical to innovation, because indeed, innovators need to feel secure that there is a market for their innovation. They need to know that if they're investing in trying to come up with brand new ideas, somebody's going to pick them up. And we can help with that, working alongside our partners, such as AT 2030, Innovate Now, the Catalyst Fund, and others that Kathy mentioned. We're working now at AT Scale to try to make the case to funders and governments for this. Our ambition is to mobilize $300 million over the next 5 years, with the aim of a threefold leverage from increased domestic resources, private sector support, and funding through other channels to try and unlock more than $1 billion. And we believe that with this investment, we can try to address critical gaps and catalyze action to ensure that 500 million more people are reached with life-changing AT. As we'll likely hear more about in this session, we're today at the cusp of many new innovation breakthroughs. In fact, just a piece of statistic, the WIPO report published last year showed that patent filings for conventional AT are growing at 6% per year. And for emerging assistive technology, that rate is 17% growth per year of new patents. So really there is a growing trend here. And some of these innovations are high tech, some are low tech, some are around remote care, telemedicine, task shifting, others around supply chain and 3D production, yet others around innovative financing models, not to mention the multiple fantastic apps that are being continuously developed. For example, smartphones to register amputees in remote locations in the Philippines, which have increased access to prosthesis, or the use of telemedicine for confirmation and referrals of complicated cases so that less specialized health workers can do basic hearing screening. We're committed to leverage the AT Scale partnership to help bring to scale those innovations that promise to best improve the lives of the hundreds of millions who need it. And I hope you'll join me and the movement to unlock the potential of these millions. I thank you and thanks for having us and look forward to the discussion today. Thank you.
Thank you so much, Pascal. And really interesting just to have that oversight there. And I think a few things that I noted down from what you're saying was around that the key elements of there being no single solutions, but actually the importance of healthy markets and security for ventures and entrepreneurs and businesses that are entering into those markets, but also that vital element of unlocking funding and just the sheer broad range of innovations and technologies that are so critical to this sector. So next I'm going to be handing across to WASI, and I shall let Georgette and Brenda from WASI introduce themselves and a little bit more about their venture. But I think the introduction from yourself, Kathy, and Pascal have given a wide insight into those kind of large scale challenges. And I think those can be then echoed very much through some of the story we'll hear from WASI today about their innovation journey. So welcome, Brenda and Georgette. I shall hand across to you, and we look forward to hearing a little bit more about WASI.
Thank you very much. My name is Georgette Ocheng Dauchie, co-founder of WASI, and I'm joined by Brenda Katwesije, who's as well on the call, co-founder and CEO. WASI was founded in 2017, and WASI was founded to create access and affordability to eyewear for the people of Uganda, particularly those that could not afford glasses or couldn't even get access to eye care health. And over the last couple of years, WASI has been able to do different products to address this need and the ability to have people get access to eyewear and eye care. WASI currently has a diversity and dignity of choice that will fit African facial futures. In Uganda, 3 million glasses have been imported, and 99% of these glasses are imported with European facial futures in mind. But as WASI, we are able to design and manufacture eyewear that would fit African facial futures. This is able to give the middle income the ability to buy glasses and choose glasses for their facial futures. And Wazi, over the last couple of months, working with the AT Impact Fund, has been able to develop a cross-subsidization model. And this is to enable Wazi sustain its impact for everyone that can afford a pair of glasses of about $150. A percentage of that goes directly to the person who cannot afford the pair of glasses and who cannot afford to get access to eyewear. And if you could just go to the next slide, please. Thank you. Wazi has been able to grow its product range over the last couple of months, 6 months of doing venture building with AT Impact Fund. And how has Wazi been able to do this? Wazi has been upskilled technically and has been trained in manufacturing in order to do this. One of the challenges that we have been facing is we have been having inefficient and an expensive production process. And this made it very difficult for us to scale our impact and hence to become a sustainable company. Again, one of the challenges was limited range of eyewear designs. And of course, to overcome these barriers, we have been able to pivot our manufacturing process. We recently went for a training in France, which is where we also got machinery. And because of this, we have been able to include designs made for African faces. As well as with the venture building, we have been able to shift our marketing approach. We have launched a new marketing strategy, and this coming together has enabled us to fill our skill gaps, grow our marketing and our sales. We have been able to collaborate with different people in the Ugandan market, telehealth companies, distributors, corporate companies, non-profit companies, and this has enabled us to scale our impact. Over the last couple of days, we have had a doubling in our sales, and when our sales double, that means our impact doubles. For each and every pair of glasses bought by someone who can afford, it directly goes to the person that cannot afford the pair of glasses and cannot afford to get access to eye health care. We are in the next couple of months and years to come, we hope to grow in Kenya, Rwanda, and Congo. I'm happy to take any questions if you have any.
Excellent. Thank you so much. That was really interesting just to get that overview of your journey and actually how you've worked to overcome some of those barriers and the impact that working alongside a program such as the Assistive Technology Impact Fund, which is part of the Global Disability Innovation Hub's AT 2030 program funded by UK Aid, has enabled you to kind of take some of those steps forwards and capture some of the expertise and the learnings and really, I guess, kind of catapult Wazi into the next phase of its journey. So I'm sure we'll have some questions for you coming on later today, and we'll hear a little bit more from Lee and Michelle, who are on the panel, who will be able to give us a little bit more insight into the Assistive Technology Impact Fund and some of the work that fund has been doing with Wazi and a number of other ventures in terms of looking at quite pioneering models to fund AT scaling of products within kind of local environments. So we will move on to our panel discussion for today. So the first question we have is looking at can investments overcome the wide-scale challenge of AT market failures? So to begin this, we are going to come to Lee, who I just mentioned. So Lee, it would be really fantastic just to hear a little bit around kind of what evidence we've seen that might support this. And I guess what your overall kind of interpretation would be around what is the role of investment in overcoming those market failures.
Super, thank you, Louise. And hello, good morning, good afternoon to everyone who's here. It's a pleasure to be part of this really important and exciting discussion today. And to kick things off, I'm going to say that if you are listening to this and you've heard from Pascal and Kathy and you're thinking that investment is necessary in the sector, you're right, and that's great. But I really want you to think about investment in a bit of a different way to just simply injecting funds into talented startups or entrepreneurs and organizations. On the AT Impact Fund, we've had the great pleasure of working with organizations like Wazi and others over the past couple of years. And what we've seen is that oftentimes while the money is very important and helps to prop up some of the initiatives and the work being done by folks like Wazi, sometimes it's the stuff that money can't buy, the things that, as the AT Impact Fund calls our kind of scale studio support. That's access to experts, links into new countries, critical friendship from people who've been there and done that is the stuff that matters even more sometimes than the money. So invest the money, but also think about the kind of non-financial support that it needs to be accompanied by. I would say that even then, you're still kind of at the start. Because, you know, for folks like Wazi, when they come into a new market and they're working in a relatively nascent sector, there really is a lacking enabling environment for them. What we've seen across our portfolio of grantees is that these teams really bear what we call the innovator's burden. That means they need to think about their product, they need to think about their brand, they need to think about their marketing, just like anyone else who's working on something might need to. But they also need to properly invent entire distribution channels, think about business models that haven't been invented before. They bear the burden of the entire enabling environment themselves. So again, if you're thinking about investing into the space, think long and hard about where you're working, who you can partner with, and how you can give folks like Brenda and Georgette at Wazi a more enabling environment so that they can focus on their product and their service and getting that really great. And that the rest of the burden is kind of supported in some way. The final thing that I'll say is if you're thinking about investing in this space, think about your role as incubating a sector and not just a product. This is a really, really nascent sector, AT, especially across all of Africa. And the people that you choose to invest in really does define and design the market. If you come into this sector thinking of it in a similar way to some other sectors where you're obsessed and kind of preoccupied with the ideas of scale, you will find yourselves being kind of lured into investing in organizations that can import cheap products from China, pile it high, sell it cheap, make a margin, and yeah, you know what? They'll scale. But that's not going to invest in or support or incubate a sector. We have been very mindful and diligent in picking organizations and grantees that we believe are exercising and demonstrating what we call pro-sector behavior. That means they work with local talent where possible, they think about the broader ramifications of the decisions that they're making, and we really see and consider our role in the sector and incubating that, not just the product. So Louise, I guess to kick things off, I would say yes, and other things alongside the financial investment.
Excellent. Thank you so much, Lee. And absolutely, I think what you said there, drawing upon the money can't buy, is reflections that we so often hear across a lot of the work that we're all involved in. And actually, it's having those expertise and the knowledge and then being able to implement them within ecosystems and within the right environment to enable and support those innovators to really fly is so critical. So I think we'll next come to Prateek on the same question, really, just to hear a little bit more from yourself, just about, I guess, kind of your own experiences. And so maybe if you could introduce yourself, Prateek, and tell us a little bit about your organization, what you do. And then I guess the same question to you in terms of how can you see investments role, and would you agree with Lee in terms of some of those key elements to enable that the investments to really take shape and drive this market forward?
Well, thank you so much for the invitation, and lovely to be a part of this wonderful event. Very, very excited to meet all of you again. I think from my perspective, the answer is yes, or maybe, depending on what's the definition of investment. Yeah. Now let's take a narrow view. If you take a narrow view of, if you're talking about financial investments in startups, absolutely yes, right? Invest in the journey of startup. You will need a growth capital. You need, I think in our field, we are talking about terms like patient capital. Now, I'm based out of India, and we created this organization, ATIA, a few years back to support and create the whole ecosystem, not just startups, but beyond startups as well. And Lee, I completely agree with you. There are a lot of things which money can't buy, and that's really is the whole ecosystem element. You spoke very, very well. Completely agree with you. See, in India, we are having a very exciting time in terms of startups. There are 41 unicorns in just 2021. So 41 organizations, not in 80, unfortunately. We'd love to see few 80 organizations becoming unicorns, but exciting time from a startup ecosystem, the way technology is being used to transform the lives, and the way, the market is being built, right? So a very, very exciting time. Now at ATF, we've created this whole ecosystem of 400 startups, 32 are in our portfolio with so many patents. But beyond this, we also have, created a Plus-N global network. And I know Bernard and Peter on call, who are the co-founders of this Plus-N network. So we're very excited about startups and the way technology is being used. In our world of AT, we're talking about dual objectives. So we are not probably going to return like a 100x, but given 15-20% returns. But for us, the impact, and in ATF, we talk about 3 themes of impact of learning, livelihood, and living of people with disability. Another, if I stay onto the whole narrow view of financial investment, also questions like, when are we investing? Are we investing in early stage? Because the grant cannot be a growth strategy, right? But you do need capital to grow. So at ATF, we are trying to create an angel network. We have thousands of people who can invest small amount of money, but then they can be large number of people, right? So they eventually get to that stage. But also what is required is the growth stage capital. The other question which when financial investment is, where are we investing? Are we again doing a mistake of investing in same or similar areas in assistive technology, or are we really being bold enough and trying to address and invest in more complex and difficult areas like tech and neurodiversity, right? Where not a lot of innovation is being done. But I think in a way we are trying to create more and more role models, because if we go with this thought of really creating some of these role models, organizations which have scaled well, there's more excitement, there are more people going to join the whole bandwagon. But I think if we only take a narrow view, it's not going to happen. And hence the broader view, where my answer would be yes, is to really invest in talent. India produces 1 million engineering graduate annually, 1 million engineers annually. Can't we have 10,000 engineers working on assistive technology? Can't we put together an ecosystem where a lot more research and development happens in the areas which I just mentioned? Why are we not investing in building distribution system? Traditional distribution system in assistive technology are not working. Can we try micro entrepreneurship as a form of distribution system? And that's really working very well in India and some other areas. How are we investing in creating newer business models? Because we are not going to probably crack the B2C or B2B. Can we try B2B2C? Or there are innovative finance mechanisms which are being available? Are we investing enough in policy framework? Are we investing enough in building positive partnerships? But so these are a few thoughts, but I'm very, very excited that we are now bringing some of these discussions, some of these important topics to forums like this, and I'm sure a few years from now, we are going to celebrate the success of having few unicorns in assistive technology, either from India, Canada, UK, or Australia. I am also very excited that then in that case, we will go back to sessions like this and say, oh, we did right set of brainstorming, and investment in this sector to create a lot of role models. But back to you, Louis. These are my thoughts.
Thank you, Prateek, and really interesting just to hear some of those elements from yourself and the Assistive Tech Foundation. And I think what really captured me was you mentioned that 3 L's, the learning, livelihood, and living. And I think that really highlights, I guess, the wider impact of AT and really kind of puts into context the implications for all different aspects of not just an individual's life, but also going back to Pascal's introduction, looking at actually the value and the investment and the return, not just to a person and their family and their local community, but on a much wider economic scale as well. So fantastic. Thank you so much for that. We're now going to move on to our second question. And this is just really to go back to looking at how the sector can pioneer change. So I guess what are the new approaches to investment? And it's something we've touched on a little bit already, but what is it that's showing promise, and how can we further explore those areas? So I'm going to come to Pete, Pete from Merkle. So I shall let you introduce yourself, Pete, and tell us a little bit more about yourself and your organisation, and just hear from you around how you think the sector can move forward in this space.
Yeah, well, for the opportunity, and it's really great to be joining you from the other side of the world, from down under in Sydney, Australia. And thanks to GDI for putting on this amazing event. It's great to be amongst an incredible panel of incredible experts. So thanks for offering us this opportunity. So Remarkable we enable human potential through technology, and we launched an accelerator to begin with back in 2016, and we've invested in 40 companies so far. And now we're needing to see some more work being done to both grow the pipeline of new innovations coming through, and then also give that end-to-end support as companies start to scale as well. So we're just starting to do that across the portfolio, and we'll be growing out the work that we're doing. But I guess in answer to this question around kind of how the sector can pioneer change, there's been some really interesting developments, I think, in terms of financing models that have come through. And you know, this isn't I guess just special for the disability sector. It's happening across all areas, and really it's quite an exciting time for technology and the development of innovation as well. I think we're in a particularly interesting period of time where both you know, access to building new products is actually one of the lowest barriers to entry that we've ever had. We're seeing technology being able to be developed with such a low cost. We're also going through digital transformation as well. But secondly, there's a market that's forming, and Georgette before mentioned that, you know, there is a growing middle class around the country, around the world, that is able to make choices for themselves. So there's this growing market of people who are able to make purchases for themselves. But then I guess the space that we're kind of talking about tonight is really that investment space. And certainly when we started our journey back in 2016, investors that we spoke to said, look, there's no shortage of capital. There is a lot of capital around. It's actually about finding investable things to invest into, and we need to lift the excellence with which we bring investable things. But I think that there's probably just four things that I think that we've seen that are quite interesting models around investment. And one of those, as I said, it's not just distinct to the disability sector, but we're seeing products come to market through crowdfunding. So people putting out their vision in a high fidelity way to show people that this is the kind of thing that I want to build. And then people get behind it. People actually rise to the challenge and say, I'll back that product or that technology or that innovation. And we've seen that with even one of our own companies, Ability Made, who are using 3D scanning and 3D printing for orthotics. They did a crowdfunding campaign early on. The second thing is kind of equity models. And so that's, I guess, some traditional ways of investing into companies. And here, I guess we see a shift in the way that companies are operating. Traditionally, the disability space has been made up predominantly of not-for-profits. But we're increasingly seeing more for-profit, for-purpose organisations coming through. And so they're able to give away a small portion of their business. And so accelerators and incubators, some of them are taking small portions of equity in exchange for some investment support. And they also can bring on investors as part of that. We're seeing some interesting things in Australia around even blend forms of finance. So where we're seeing some philanthropic money going in, we're seeing equity and loans being offered. A couple of years ago, one of our startups was the very first to receive a very new form of loan called a BOLD loan. So it's beneficial outcomes for linked debt. So what that means is that the start themselves do take out a loan and they pay back the principal, but they also can pay back the principal through the outcomes that they get. So part of that is a really new innovative model. And we're even seeing things in other sectors as well, like She Starts is an organisation that's now global, trying to encourage female founders to start their own businesses. And so female founders are gathering together and putting up small forgivable loans to encourage more females to become founders themselves. So I think we're at a really exciting point in our history of quite a few new approaches that show quite a lot of promise. I'll hand back to you, Louise. Thanks for the opportunity.
Thank you, Pete. And I think some of the elements that you mentioned around the low barriers to entry in some areas and some specific bits of tech and innovations, but also that market is very much forming. And I think we've already touched on it, that it feels like this is a really interesting start point. And those 4 different areas you're mentioning of different approaches and funding mechanisms, I think show the scale and the breadth of the opportunities out there, but also the different approaches. And that actually it might be really, it's a really mixed bag into what works in what environments and what climates and for what inventors and innovators that are out there. So Kathy, I'll come back to you now just to hear a little bit more around some of the work that the Global Disability Innovation Hub have been doing in this space, and maybe some of the evidence that we've seen from the different approaches to investment.
Yeah, and I'll loop Bernard in at some point in that conversation too. So we're seeing a little bit of like what Pete says. From GDI Hub's point of view, we started back in 2016 and did some great stuff on makeathons with the International Committee for the Red Cross. We then worked in Kenya in scoping studies and did full clinical trials of assistive technologies and alongside more qualitative work. And that scoping study in Kenya helped us set the scene for Innovate Now, which Bernard has excellently delivered and directed in Kenya. And I think Bernard's work has helped connect those two things. There was a question in the chat about how we connect the bigger ecosystem. And I think Bernard can talk in a minute about how his ability to direct an accelerator, but also sit on committees within the Kenyan government helps to join the dots in this space. We're also seeing a lot of what Pete says. So we're seeing investors beginning to want to reinvest. We are seeing a lot of debt financing coming out. We're seeing a shift away from grant income and grant being used to de-risk investment for other funders. We're seeing a lot of long-term investment. We're starting to package that slightly differently within GDI Hub. We're launching a rebranded version of our innovation space called GDI Accelerate in the next month or so, and with sector leaders and with our partners, with Lee, with Bernard, with others. And so I think there is this appetite for growth and change in the sector. I think we're at that precipice, but I would like to hand over to Bernard because he's been at that cold face of connecting those two worlds on the ground in Kenya for us, and it would be nice to hear from him if that's okay, Louise.
Yeah, thanks, Kathy, and yeah, thanks everyone. Greetings from Nairobi. Just to kind of build up on what Kathy said, you know, it's some of the changes that are driving this sector is this idea of an ecosystem, an inclusive innovation ecosystem for that matter. And when you start looking at it like that, you start to realize that everyone has a role to play, and there are you know, factors around creating success for this sector that are not about, you know, how good you are at building a product or taking a product to market. And it's things like, you know, how do you unlock, you know, the healthcare system as a channel for delivery of assistive technology? How do you work with government, you know, to ensure that they can have a view and they can know what's happening in terms of new innovation, so that it can be supported instead of being stifled by policy. And the Kenyan government in this matter, you know, has been very proactive in trying to co-develop new assistive technology policy, you know, to support the development of assistive technology across the country, So really, it's an ecosystem role, and as they say, it does take a village to raise a child, and for us, we apply the same thinking. It takes an ecosystem to raise an assistive technology startup. And I'll definitely share more, in the next segment of the questions. Thank you, Kathy.
Thank you, Bernard. So we're now going to move on to question 3, and I think we've just kind of led on to that with Bernard just kind of talking a little bit around the bigger picture and bringing in the importance of government and policy and breaking down some of those barriers. And what we really wanted to explore a little bit more is, what do startups really need? So how is it that we can drive this innovation and catapult those ecosystems? So I think, Bernard, you've just mentioned there a little bit around kind of the high kind of policy level stage, but I wonder if there's anything more specific from some of the ventures you've seen coming through Innovate Now that are real kind of blocking points on the ground that can help some of those innovators from the earliest stage to I guess kind of get on that first run on the ladder and start their journey through the process. So we'll maybe just come back to you, Bernard, and just see if you want to give us a few more examples of what you've seen from the Innovate Now running on the ground in Kenya.
Oh, absolutely. So running an accelerator now almost for 3 years in Kenya has really taught us a lot. And one of the things I like saying, and I think I strongly believe that, is that we must believe that the formula of creating entrepreneurial success essentially is not too different, regardless of the sector, whether it's AT, whether it's manufacturing, whatever it is. And so I think the lucky thing our sector has is this ability to take learnings on what has worked in other sectors in terms of supporting entrepreneurs. And of course, when the whole fad of accelerators, incubators, it was beginning, there was a lot of confusion on what really value is. And we've seen, for example, how entrepreneurship education has evolved. I mean, there's a time, for you to access high quality, education as an entrepreneur 5 years ago, that was a struggle. Today, some of the best accelerators across the world have their curriculums open source, including us with our Innovate Now curriculum. So, some of the direct value that entrepreneurs need has actually already been mentioned by Lee when she was talking about, the venture building support that you give to entrepreneurs as they try to navigate the obstacles of starting a company. And I think even at the early stage, at the accelerator stage, where we really focus on validation and helping them cross what you call the valley of death, entrepreneurs in this stage need investment. It's as simple as that. They are not trying to do a class project. They're trying to build a business. So I think what we've seen a lot in Africa, not just in AT, is this behavior where investors want to wait on the other side of the pipeline and wait for your scale ups. Well, nobody wants to go into the accelerator level and be part of creating success. And I think that's where accelerators like us come in, and we need more venture capital linked funding for accelerators. And I think what Pete has been able to do with Remarkable is truly remarkable, and we want to learn from that and ensure accelerators like Innovate Now can also not just be places to learn, but also places where entrepreneurs get pre-seed investment. Entrepreneurs also really need, to be honest, it's difficult to build a company, and especially if it's a startup and you're doing this for the first time. So a lot of times we don't look at, the cost of doing that. Today I was just speaking to one of our alumni companies, Hope Tech. Brian is one of our brilliant founders, and he's given me amazing news. He's almost getting his international patent, I think, next week. And when I had a chat with Brian and tried to ask him, how did you get to this point? After going through Innovate Now, how have you navigated, clinical trials, design, getting your patents? And it's really an eye-opening conversation, because Brian has had to go out and stay in foreign countries to get access to some of the things that he really needs. And that's because, they are not easy to come by here in Kenya. So I think the other thing entrepreneurs need is they need to be enabled and given the ability to get into other ecosystems and pitch there. One of the ideas behind, Plus N and also GTI Accelerate is this idea that, you could be from Kenya, but pitching to to investors in Australia or in the UK. And in Silicon Valley, this is not a strange practice. You have entrepreneurs that move from one side of the US because literally the investors are on the other side. And I think, the beauty about what we are building here is that it's an ecosystem. And within this ecosystem, we have to enable our entrepreneurs to access, what's easily available, for example, in the UK, if it's not in Kenya. And I think lastly, what I want to say is this idea of creating proximity to other sectors, or ensuring that the AT startups can leverage on what has worked in other sectors. And I think in Kenya, one of the most thriving sector, for example, is fintech. I mean, here we talk of mobile money, everything from loans to I don't know, you name it. And I think one of the solutions for this sector could be in fintech, because one of the barriers to accessing AT is the upfront costs, to assistive technologies. So where are your pay-as-you-go financial products or insurance products that could help really open up that sector for the end users? And I think this is an interesting time, because working together, we can test these models. Thank you.
Thank you, Bernard. And absolutely, I think what you've touched upon throughout that is really looking at the importance of collaboration and working in partnership, but also those learnings that across the space and across everyone here on the panel, but also much wider, is that actually together we are very much bigger than some of our individual parts, and by taking those learnings and by sharing and in some respects being vulnerable when things are brilliant and when they go right, and actually taking those learnings from where there are challenges enables us all as a sector to drive forward and really kind of capture the opportunity that's available at the moment. I mean, we've very much seen that there's so much opportunity within the sector for growth, and that now is the time for this to really kind of accelerate. So building on that question, I think it would be really interesting to come to you, Michelle, from the Catalyst Fund, just to hear a little bit more around some of your experiences working with startups, and whether they kind of echo some of what Bernard said around some of those. How do we help and support as a sector these startups crossing over those challenges and being able to really scale up their innovations in a way that is a business approach and does have that longevity?
Thanks, Louise. And as Bernard was talking, I was like, yeah, it's the same things we've been seeing in the fintech sector as well. And this is where we're talking about kind of cross-learning based on the sector. So as a Catalyst Fund, we are an accelerator program that supports early stage fintech companies around the globe, but with main focus in Kenya, South Africa, and Nigeria in Africa. So one of the things came out from all of these was three key things that we are seeing cutting across between the fintech sector and the AT sector. Bernard has mentioned definitely funding is a key thing. We keep hearing from both sides, but also more importantly, the patient capital, being able to test out. So at the AT Impact Fund, what we ended up doing was to actually give them, some of the portfolio companies, some money to test out new ideas, especially on things of access to assistive tech, but also distribution, and be innovative around that area. So having that aspect of saying, for example, Kuala? How do you bring prosthetics in Sierra Leone, in a country where people are very low income and not able to actually access it? So what innovative ways are you able to actually do that to increase access? Similar to WASI, like with the testing and the ATIV impact was like, how do we reduce the pricing, but also move the manufacturing closer to the people so that one, the pricing becomes cheaper, but also giving the skills in kind of like local manufacturing. So being able to actually help the ecosystem, not just the startup of saying, let's bring X to Y, but how do we build all this also in country as well? Definitely the second thing we keep hearing, and as Lee has mentioned, was the importance of venture building. Money is great, but more importantly, how do you do it? So as ATIV, what we ended up assisting them was getting experts from a lab group. So things like Catalyst Fund coming in with business skills and everything, Bring coming in with also their skill set, and GDI Hub as experts in the AT sector saying, how do we improve the product so that the product is well, but also then how do we solve the process of distribution as well as access? So testing out different models. So we had things like, as Georgette has mentioned, helping them with marketing so that people are actually able to aware access to it, but what's the pricing? But also thinking about financial modeling to make sure that it's cheaper for the people to actually help. And then definitely distribution of who's the right partner to partner with. So some of the portfolio companies, one of the things we realized immediately was some of them wanted to actually go to a different country, but then what's the best way to go about it? So kind of trying to test out different business models to be able to actually enable all those things, as I said, again, distribution and access so that we're able to actually have AT to the people who need it. The third thing that also we've seen cutting across both the fintech sector and the AT sector is the importance of connections. And I think that's why most of us are also here. Like, how do you actually create that whole partnerships and connections to be able to actually give those access? So for example, with the ATIV program, what we're able to do is like give access to people within the whole ecosystem. So not just only investors in the ecosystem with what we were trying to do with circle of investors, but also to the partners, what we call adjacent to AT. So people can be like potential to be able to actually increase the distribution channel and everything. So for example, one of our portfolio company here, Rex, wanted to come to Kenya and they're trying to think about what's the best model to go about it. And now they're partnering with Ilara Health, which is a startup still, but also helping like with 250 pharmacies across Kenya to say, you can be able to get checked with hearing aid in one of these clinics and be able to actually to access it. And as Bernard said, okay, what's the best model? So pay as you go is simple. So we're trying to test that also as well. So having partnerships with Safaricom and all other companies to actually able to support that. Also, I think like example in Kuala in Sierra Leone is giving them partnerships with like the government, CHAI as well, Clinton Health Initiative Foundation, to just help them think through what's the best way can they go about it? How do you enable that whole ecosystem? Because as Bernard had mentioned, we can't just stay alone and saying this is the best aspect, but how do we build a whole ecosystem around AT to be able to actually solve the problems of AT? So I think all those things are still important, and helping the startups to actually kind of reduce the innovation burden that Lee has mentioned, like how do we enable that to support them? Thanks, Lois.
Thank you so much, Michelle. I think it's really important that you touched across some of the challenges around distribution, and I think all these different elements really add up to give us the wider picture of the environment we're working within, and some of those barriers that may be blocking some of the opportunity at the moment. And we've touched on throughout the session talking a little bit around kind of now really feels like the time, it feels like the start point, and there feels like an opportunity here for investors and investment, and for different sectors to really join up and link up to maximize and scale this opportunity. So I'd like to take this moment to come to Pascal just to hear a little bit more, I guess, about your perspective in terms of why now is the time really, and why it's so critical that through collaboration and working together we can really kind of drive forward this space.
Sorry, Louise, was that to me?
We're going to pop to Pascal first, and then we'll come to you.
Sorry, my audio's broken a bit.
No, thank you for that. And now is the time. Indeed, I mean, yesterday was the time. You know, I think just a quick reflection from someone who's actually quite new to the sector, as I am. It's just shocking, truly shocking, that so little, you know, has been done in this space relative to what the needs are and what could be done. So I think, yes, now is the time, but again, I think we're already running behind and we need to catch up. We need to accelerate even more. I think what's particularly interesting now, perhaps though, is a sense, you know, that moving away from a fragmented kind of maybe more siloed way of working to really trying to bring this together, integrating this more into other sectors, recognizing also the multi-sectorality of the issues here. Yeah, I'd like to think that now is different than before. I think tomorrow will be the proof of that. And let's make sure that when we reconvene 4 years from now on this, we won't still be saying that now is the time. Thanks.
Thank you, Pascal. Absolutely, I think that's a really good analysis to make there, that yesterday was the time, and that actually, if we reflect back on where we were 4 years ago at the last Global Disability Summit, and to the privilege of being here today, and to where we've come, is a really exciting space and has really shown the innovation and I guess the growth within this space. So Kathy, we'll come to you just to, I guess, hear those final reflections. And we've had some fantastic questions coming in the Q&A box, and thank you to all the panel for contributing and feeding back to all those audience questions coming in. I know a lot of them have been quite specific on some of the products and some of the technologies, but also a little bit more widely around how different sectors can interplay within this space. So not to give you a huge question as we come to wrapping up, Kathy, but I guess just touching on some of those different I guess different players within the space, and how we can work together, and what next for the next 4 years up until as we come towards the next GDS.
So Pascal, I'm not sure I'm going to do better than yesterday was the time, but I think that we can ground ourselves in a post-COVID world. In many ways, COVID helped us a great deal generate evidence to everybody of what social disability is like. It also enabled us to transfer to digital ways of working in a significant way, which can have huge benefits for disabled people or people with disabilities globally. However, it also enhanced inequality globally. We saw that with the vaccine rollout, for example, and persons with disability or disabled people were disadvantaged during that time significantly. So I think when we say the time is now, the time is to forget about any internal arguments. The time is to forget about any disagreement across sectors. The time is to grasp the opportunity. And I believe the opportunity is here. I am a computer scientist, so I am biased, but I believe that digital will help us unlock a great deal, but only if we get the attitude right. And we need to get the attitude right at every single level. So I would leave us with a challenge for the next 4 years, which is how have we each individually and through our partnerships and through our institutions helped to create a more disability just world, a more equitable world is possible, I believe. Disability innovation is core to that, in my humble opinion, not only to a fairer world, but also to a more resilient world. And we must align with the sustainability agenda if we're going to achieve our aims. So we'll design solutions which solve for exclusion, and we know that when we solve for exclusion, we will make ourselves a better and more resilient community. So our challenge, I think, with myself, and maybe when we roll into the agenda later this evening this evening if you're in the UK time zone, where Pascal and me and some of the at-scale conversations, I think is how we measure this impact and how we measure this change and how we tell the story to all of the different stakeholders. But the time is definitely now. It was yesterday, but we're in the present. So we'll move from the present, and in 4 years' time, I hope we're all coming back and just leveraging our success into the mainstream. Thank you.
Thank you, Kathy. And a huge thank you to all the panelists that have joined today. That's us pretty much a wrap. So thank you to everyone for joining from all over the world. It's fantastic to have you all as part of this session and for all your questions. And I know we've had a lot of engagement between the panelists on those. As Kathy mentioned there, we are involved in and co-hosting another session this evening with At Scale that we're really excited about. So please do join us for that session and we'll be able to delve a little bit deeper into some of these topics around AT during that. And thank you again for everyone for joining and for our International Sign Language and captioner for providing that insight for today. And we hope you enjoy the rest of the Global Disability Summit. Take care. Bye-bye.